All right, page 670. Trace and toxic elements. This is another one that's going to kind of be overview, and we are not getting into all of this just because it's just you don't see it very much. 670. 670. Yeah.
I wonder, I thought, that's the name of the chapter.
Now y'all just read over slide for it. I was like, ain't that the slide for it? Which one's the slide for you? I just read it. Page 670. Almost half of the elements listed in the periodic table have been found in the human body. Go down to the green ultra trace elements, the sentence after. The World Health Organization has established a dietary requirement for nutrients as the smallest amount of nutrients needed to maintain optimal function and health. Go to sample collection and processing. Specimens for analysis of trace elements must be collected with scrupulous attention to details such as anticoagulant, the collection apparatus, and specimen. I'm sorry, actually, I got it in here. Page 671 in chemistry. But, so this time about specimen collection. The specimen type, urine, whole blood, serum, plasma, hair, nails, all of those can be used. Because of the low concentration in biologic specimens and the ubiquitous presence of trace metals in the environment, extraordinary measures are required to prevent contamination of specimens, which include using special collection tubes. Royal blue, with or without EDTA, is what you use for trace elements. Royal blue. The one with EDTA, when you spin it down, it results in what? Serum or plasma? With EDTA, plasma. That is an anticoagulant. Same anticoagulant used in your CDC tube, right? The lavender tube. Or you can just do the royal blue tube with nothing in it, and that gives you a serum. Yes, nothing in it, right? No anticoagulant. But royal blue top tube. Turn the page to 677. Arsenic. We talked about it a little bit yesterday. Go to health effects and toxicity. Second paragraph. It's a white powder. It is odorless, tasteless, and it's one of the most common poisons in human history. How, what's significant about it? People use it as what? For murder or suicide. Yes, we talked about it yesterday. Because it's odorless, it's tasteless, and you know it's kind of easy to slip people because they don't taste it and they don't smell it. So, but go down to the very last paragraph. In the year 2000, the FDA approved the use of arsenic for the treatment of acute promyelocytic leukemia. Isn't that crazy? Turn the page to chromium. We're not going to talk about every one of these because you don't see it. Chromium makes rubies red and emeralds green. It's the 21st most abundant element in the Earth's crust and is used in the manufacturing of stainless steel. Occupational exposure to chromium occurs in wood treatment, stainless steel welding, chrome plating, the leather tanning industry, and the use of some paints. Go to health effects, efficiency and toxicity. Chromium is also an essential dietary element serving to heighten the action of insulin. So go down 3 lines. Foods such as breads, fish, fresh vegetables, meat, and even beer are common dietary sources of chromium. So we do ingest chromium, but it's at a safe level. The time that you might have toxicity is where it's talking about with welding and stuff like that. Turn the page. Copper. Next paragraph. The copper content in a normal adult human is 50 to 120 milligrams. Go to health effects, deficiency, and toxicity. Copper is a component of one of the main ones, ceruloplasmin. Y'all remember talking about copper and ceruloplasmin with the liver and what kind of disease? What's it called? Wilson's disease. Yep. The next paragraph. Copper deficiency is observed in premature infants because the absorption is impaired in severe diffuse diseases of the small bowel, lymphsarcoma, and scleroderma. It is related to malnutrition, malabsorption, chronic diarrhea, hyperalimentation, and prolonged feeding with low copper total milk diets. So total milk means that's all you're eating.
Copper bracelets they do. What is that like?
It's for when it says like ailments or whatever, it's like apparently like joint pain and stuff like that. It apparently helps you. I just don't think it will, but
I was trying to figure out how that just sitting on me.
yeah. Well, because you can absorb it through skin, but I don't think that it really makes a difference. It might, I don't know. I never tried it. Go to not the next paragraph, but the next. Copper toxicity has been associated with hold on. City been associated with living near copper producing facilities, using water from copper pipes, cooking with copper lined vessels, exposure to herbicides, ceramic glazes, electrical wiring, and welding supplies. Next paragraph. Wilson's disease is an autosomal recessive disorder of copper accumulation. Clinical findings include neurologic disorders, liver dysfunction, Go a little bit more. Early diagnosis of Wilson's disease is important because complications can be effectively prevented, and in some cases, the disease can be halted with the use of zinc acetate or chelation therapy. Serum ceruloplasmin levels and the direct measurement of free copper are key diagnostic steps in the diagnosis of Wilson's disease. Iron. Next paragraph. Although highly abundant in the Earth's crust, iron is classified as a trace element in the body. Go down a little bit more. It fills numerous biochemical roles as a carrier of other substances such as oxygen. We know that. Go to the next paragraph. Absorption of iron from the intestine is the primary means of regulating the amount of iron within the body. Go down 4 or so lines. Because iron is the predominant form of iron in foods, it must be reduced by agents such as vitamin C, like you drink orange juice with it, or ferric reductase present in the intestinal epithelium before it can be absorbed. Because remember, vitamin C doubles its absorption. So that's why you can drink orange juice, which contains a lot of vitamin C in it. Got 9 lines down after 120 days. Because that's when what? Well, before that, red cells destroyed. Red cells are degraded by the spleen, liver, and macrophages, which return iron to the circulation for reuse. Absorption and transport capacity can be increased in conditions such as iron deficiency, anemia, or hypoxia. From the page. Go down like 5 lines, 5 or 6 lines. Iron is stored as ferritin. And it's transported as what? Okay, next paragraph. Iron deficiency affects about 15% of the population worldwide. Those with a higher than average risk of iron deficiency anemia, pregnant women, young children, adolescents, and women of reproductive age. Increased blood loss, decreased dietary intake, or decreased release from ferritin may result in iron deficiency. Go down a little bit more. You have anemia. It's demonstrated by decreased red cell counts, mean corpuscular hemoglobin concentration, actually all of your indices, right? Iron deficiency, all indices, and microcytic and what red cells? Microcytic and color, hypochromic red cells. Iron overload. They are collectively referred to as hemochromatosis. Write this down. This is not in the reading. So this is iron overload. These are 3 causes. If you take a vitamin overdose, so if you take iron every day, like sometimes you need it, but if you don't need it, you're going to eventually get an overdose, right? So vitamin overdose. Number 2, hemosiderosis. And then number 3, hereditary hemochromatosis. Hemochromatosis. Primary iron overload is most frequently associated with hereditary hemochromatosis. It is an autosomal recessive disorder leading to abnormally high iron absorption accumulating in iron overload. How do you, for people with hemochromatosis, what do you do? Iron chelation or therapeutic phlebotomy. It's the key reason that's what it says. Lab evaluation of iron status. You can do a total serum iron, packed cell volume, hemoglobin, red cell count, and your indices. Total iron, TIBC, that's what I just said. Percent saturation, transferrin, and a ferritin. Look at the table 27.3. So if you look at iron deficiency, your total iron is decreased. Your ferritin, which is stored, iron storage, right? So if remember what happens with iron deficiency anemia is when your what is depleted. Your storage is depleted of iron. So if your iron stores are called ferritin, your ferritin's what, right? okay? So total serum iron is low, ferritin is low, percent saturation is low, but then transferrin, so transporting the iron, trying to transport it back to be reused, okay? It's going to be elevated, and so is the TIBC, which is your total iron binding capacity. But if you look at your iron overdose and hemochromatosis, is opposite from that. So an iron overdose and hemochromatosis, your total iron is going to be elevated. Well, if your total iron's elevated, that means your stores are going to be elevated too, right? So your ferritin will be elevated. Your percent saturation will be elevated. And then your transferrin and your TIBC will be low. Know those. Iron deficiency and iron overdose and hemochromatosis, which basically are the same thing. And then you can read about the different ones. Transferrin is your transport protein. TIBC, it is a calculation that your chemistry analyzer does based on the transferrin and the iron. And of course, ferritin is your iron stores. So lead, we talked about this yesterday also. Lead is also called or abbreviated as PB. So if you ever see PB, that is lead. Don't ask me why I didn't make the periodic table. That makes no sense to me. Huh? Oh, there you go. So did a Latin guy make the periodic table? Oh, gotcha. So, what top two are you going to use for lead? I just said it yesterday. Tan. And you can use the EDTA also if you don't have a tan available, but they prefer the tan. Go down, about 10 lines where it says the manufacturer of lead-based household paints. It was banned in the US in 1972, but lead is still used in paints intended for non-domestic use. Toxic concentrations of lead can be found in areas adjacent to homes painted with lead-based paints and around highways where it accumulated from the past use of leaded gasoline. So now, if you think about it, what type of gas, like regular gas, what's it called? Unleaded, right? So a lot of times now, so which group of people are at most risk for lead toxicity? Children. Why? Because they chew on everything. Okay, so go to absorption, transport, and excretion. Exposure to lead is primarily respiratory, like with the gasoline, okay, but now we use unleaded, so that's very rare, or gastrointestinal. Go down a little bit more. Gut absorption depends on a variety of factors, including age and nutritional status, with enhanced gastrointestinal absorption occurring in children younger than 6. Go down to health effects and toxicity. So used to, back in the day, toys used to contain lead. And of course, what do kids do with toys? Right in their mouth. One of the daycares here they had to redo the daycare because it was painted several years ago. And we had a kid come in with extreme lead levels. And whenever you do lead levels and they are extreme on a patient, the state then takes over and they follow up with the patient, the parents, and they try and see where the source of the lead is. And this particular kid, it led back to the daycare. And it's because the kid was eating paint chips off the wall. The kid thing. And you gotta think paints in cribs. Whenever kids are teething, they gnaw the heck. Like Marley had literal like bite marks on the edge of her crib from when she was chewing on it whenever she was teething. And thankfully it wasn't painted. Lead-based paint, or she would be, which she's still kind of, but not due to that. So health effects and toxicity. Go down 4 or 5 lines. Typical threshold for acute clinical intervention is chelation therapy. IQ declines are seen in kids with blood lead levels of 10 or higher. So IQ declines in lead levels of 10 or higher. That is crazy. Because what were we say yesterday the normal lead level was? 3.5. You want it less than 3.5. And they say the other chapter, I think it said they started seeing symptoms at 5. Symptoms meaning like maybe like iron deficiency, slow, like get slower, but literal IQ declines at 10. Like that's nuts. Other central nervous system symptoms of lead toxicity include clumsiness, gait abnormalities, meaning like if you sway or something, something like that. Headaches, behavioral changes, seizures, and severe cognitive and behavioral problems. Go to the next paragraph. Lead exposure is primarily in 2 settings. Childhood exposure through paint chips, or with adults, it's through the smelting, mining, and ammunition, soldering, plumbing, stuff like that. Lab evaluation of lead status. The most common specimen type is whole blood. And you see reference range less than 3.5. And at what appointments do a kid get lead at in the state of Georgia? 1 and 2. When they're 1 and 2. Turn the page. Mercury. Last paragraph under mercury. It's widely used in small concentrations in eye cosmetics, especially mascara. Under mercury, last sentence of the first part. Second paragraph, first part. Health effects and toxicity. Mercury has no known function in the human body. Toxicities have been observed following inhalation, ingestion, and dermal absorption of mercury compounds. Mercurial salts were used as diuretics, topical disinfectants, and laxatives before mercury toxicity was well understood. Go down a couple lines. Although it was widely speculated that mercury-based preservative could cause or trigger autism in children, scientific studies show no evidence to support that link. Nevertheless, thimerosal, which is mercury, has been removed from or reduced to only trace amounts in all U.S. vaccines recommended for kids 6 and younger, except the inactivated influenza vaccine. A law, I don't know that it says this, but old time mercury thermometers were also used back in the day to check temperatures. Huh? Yep, that is true. Zinc on page 689. 3 lines down. Zinc is used in a production of alloys, especially brass, in galvanizing steel, in die casting, in paints, in skin lotions, as treatment for Wilson's disease and many over-the-counter medications. Go to health defects, deficiency, and toxicity. Second paragraph. Zinc deficiency causes growth retardation and testicular atrophy, slows skeletal maturation. Testicular atrophy meaning your testicles don't drop. Slows skeletal maturation and reduces taste perception. Next paragraph. However, zinc is relatively non-toxic. Now the next is an overview of your vitamins. Look in table 27.4. These are talking about deficiencies in certain vitamins. Vitamin D deficiency causes rickets and osteomalacia. Rickets in kids and osteomalacia. Vitamin K, decreased ability to form blood clots and hemorrhage. Go down to the water-soluble vitamins. One of the main ones is vitamin C, or sorry, go back to vitamin B12, or sorry, vitamin B9. Folic acid, megaloblastic anemia, and neural tube defects. Then vitamin B12, pernicious and megaloblastic anemia. And vitamin C, scurvy and osteoporosis. You need to know all of those. So go down to the reading. Vitamin A, besides that, put retinol. It's known as retinol. Vitamin A. And just write out beside it, retinol, R-E-T-I-N-O-L. What is retinol used for? Or what used in? Y'all know?
What's that?
Eye drops. Yep, yeah. Turn the page, vitamin D. It's used for proper skeleton formation. What's the main source of vitamin D? Sunshine. Go to vitamin K. It is a group of compounds essential for the formation of prothrombin and at least 5 other coagulation proteins, including 7, 9, and 10, and proteins C and S. Go to the next paragraph, 3 lines down. When vitamin K antagonists, such as warfarin or Coumadin, are used for anticoagulant therapy, anticoagulant factors 2, 7, 9, and 10 are synthesized but non-functional, so it may lead to a hemorrhagic episode. So if somebody is bleeding out, due to taking Coumadin, because you remember you can take too much, what do they give them? Vitamin K. When a kid is born, remember what ain't working yet? Or what? Their clotting factors. What do they give them as an injection? Vitamin K. Yes. So it makes you clot. Vitamin K makes you clot. Go to the next paragraph. Prothrombin time determination is an excellent index of prothrombin adequacy. Prothrombin time is prolonged in vitamin K deficiency and in liver diseases. Prolonged, because that means it takes longer to clot, right? What's the normal prothrombin time? Nope, the other one. 10 to 13 seconds. Remember? And it's saying it's prolonged, meaning it takes longer to clot. Vitamin B1 is known as thiamine. Turn the pages. Vitamin B2 is riboflavin. Vitamin B3 is niacin or niacin. Get all the way down to vitamin B7, biotin. What's that good for? Hair, skin, and nails. Got to be careful though when it comes to lab, because vitamin or biotin, if you take a lot of biotin, it can cause certain lab results to be off, like your troponin and stuff like that. Vitamin B9 is folate. Turn the page. Vitamin B12 is cobalamin. Go to the third paragraph, I guess. The Schilling test. The Schilling test may be used to evaluate vitamin B12 absorption and is used to differentiate between pernicious anemia and malabsorption in the intestine. Next paragraph. The term pernicious anemia is most commonly applied to vitamin B12 deficiency resulting from the lack of intrinsic factor. And vitamin C, ascorbic acid. Major dietary sources include fruits and vegetables. And then that's really all in the reading. And then in the chart, going back from the chart, it causes scurvy.
You know this little package that they have that's like a powder, so when you're like, you got a bad